Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of oncocytoma. Oncocytoma on pathology, one important thing is it is a homogeneous, well circumscribed mass with central scar. This central scar is important. So this central scar which is seen on histology is also seen on CT scan. On CT scan, this central scar is the important thing. And you can do an angiography. In angiography, you will see spoke wheel pattern is seen of the feeding vessels. So if this is the angiomyolipoma, on angiography, you will see that there is the lesions, the vessels are something like this, giving a spoke wheel pattern. So an angiography, you will see presence of spoke wheel pattern is important for angiography. On angiography, you will see spoke wheel pattern is seen. Then if you do an MRI, you will see presence of central stellate scar is also visible on the MRI. This is important. Then treatment is because because this oncocytoma will only involve a particular part of the kidney, so we can do a reference sparing approach is preferred in oncocytoma.
thank you and thank you for watching.